So welcome back to 10 Minute Takes. My name is Hannah Gallacher and I'm here today with Harry Rebucha, who is the Senior Clinical Lecturer and Programme Lead for the Enhanced Clinical Practice Programme. Bit of a mouthful.
I know you.
Welcome.
Thank you.
Thank you for coming.
Yeah.
So I always like to start off by having people just introduce themselves and just give me a little bit of background.
Well, basically, as you said, I'm Harry Rebucha. I've been a paramedic for about 17 years. Worked my way through different bits and pieces. Then I started thinking education was the way forward, so then I moved into teaching. I've spent a few years in teaching and I thoroughly enjoy what I do. So noticed this position had been advertised, applied, and I'm thoroughly enjoying my my period within the academy.
Brilliant, yeah. So, like you say, you've had a long career in education and in clinical practice. What is one thing that you learned as an educator that you really wish you'd known earlier?
It comes to the 3 Ps, which is preparation, preparation and preparation. You've got to remember to prepare yourself. I understand that everybody at the end of the day has lives. We all have lives. We all want to make sure we don't lose out on our lives. Yeah. And if you prepare yourself and set yourself targets, you will achieve what you want to achieve. My background is I had 3 young kids when I started doing the further education bits, and I had to accommodate that. It was eventful, but it was rewarding as well at the same time.
Brilliant, yeah. It always seems like a good idea, doesn't it?
It does. When you sign up for it originally, it's a great idea, but not after that. Yeah. But I think the end result and what you can do in your career going forward benefits.
Yeah, of course, of course. Thank you. So, with the ECP programme, how is that geared towards helping people with that next stage of their career development? What are we trying to achieve with it?
So we're trying to achieve to get the right workforce into the right place. What we find is that sometimes there's skills gaps within the workforce. In Northumbria is trying to fulfil the demand of these gaps, and filling these gaps, the ECP course is going to give us a chance to fulfil a lot of it. I'm calling them gaps, but they're not such as gaps, but the skill mix is correct, yeah. And I think on that scores, we can make sure that we get the right skills within these positions. And not only will that enhance the person who's doing the course, it'll also enhance the care of the patient, because at the end of the day, we all come to work for the reason it is making sure we give the care that the patient requires.
Absolutely. Sometimes we can lose that focus of that patient-centred care when we're thinking about just education. And I think one of the things that we do really well at the academy, and having talked to all the other programme leads and clinical leads, is that there's a real focus on making sure that we are thinking about patients at the end of the day. You know, they're just across the car park. Yeah,
without doubt. I think if we lose focus on it's a patient-driven sort of business we're in, if you want to class it as a business, then we're losing focus on the factors why we came to work. We've all got a caring side to ourselves. That's why we employed this job. The reason why I went into healthcare was because I found I was in a position where I couldn't do anything for someone, and then I took the step to become a paramedic. And I think coming into the academy to do the ECP course or any relevant course within the academy is showing that you are a caring person and you want to come and
do the best,
give your bit to, yes.
That is what we're here for at the end of the day.
Exactly, yes.
Yeah,
without a doubt.
That, and obviously staff progression as well, but it works hand in hand, doesn't it?
I think so, because when it comes down to staff progression, retaining your staff and helping them to go forward means at the end of the day you're caring for your staff. The last thing you want is to employ someone in that's your position, just stay there, do not do it. We want to instill into people forward thinking ideas to make the business better. I keep calling it a business, which it technically is, but the healthcare business, so that we are giving the best to that patient and we're doing it in an efficient way. Northumbria have lots of idea boards where you can put ideas in and everyone listens. I've been really excited about when I've come here because of what Northumbria are offering to the staff.
It's really progressive what we're doing here as well, I think, and the way that we're doing it, and you know, investing in the building and the staff is really exciting.
I think so. When I first sat down during my induction and listened to what they were offering, and it was all to make sure they retained all the best staff, they employed the best staff, and then the best staff will enhance the learning of the new staff coming through. And I was excited. And I think my excitement hopefully will go through into my students when they start coming through as well, you know what I mean? So that's what I'm looking forward to.
Yeah, you strike me as an enthusiastic educator.
I am. I'm probably slightly too enthusiastic sometimes,
I don't think there's any such
I do enjoy what I do, and I feel I'm very good at it. And I know the proof is in the pudding when it comes down to this, but I've never had any complaints previously, so I'm quite happy.
Brilliant. Yeah. So when we're thinking about the skills that we're going to teach the people on the program, what do you think are the most important skills for the future of the NMAT workforce?
So there's 4 pillars we need to go from. So these 4 skills are leadership, management, education, and research.
Okay.
They all link in quite well. We have to use these pillars to make sure we encourage our staff to get to where they want to get to. Going forward is going to be the only way of utilising research and education coupled with the management is going forward. Research will help every medical sort of department and also every patient within them departments, and it's unbelievable what research is coming through, and we want to be at the forefront of that as well, so we can start making sure our patients get the best care they can possibly get.
Brilliant. So really incorporating that cutting edge is not maybe necessarily the right word, but that really relevant, modern, contemporary research into what you're doing.
Yeah, I think, so coming back again a bit to my induction bit, they were showing you some of the research they're already involved in.
Oh, right, okay.
Yeah, and I mean, this was one of the ones was the use of drones to deliver.
Yes.
And you first look at that and you think, drones. But then when you listen to it explained, you think, yes, I understand why. You think someone has really thought long and hard. And the principles of it, if it comes to fruition and gets funded properly, will be fantastic. And that's where Northumbria Healthcare are at the present minute in time. They're looking correctly at the right sort of innovations coming through and making sure that they benefit the patient and the staff, as the Academy is doing as well. Yeah,
and I think that translates into the Academy with all the kind of sim and tel stuff that we've got, that we are thinking, how can we be in a bit of, how can we do this differently? How can we be a bit more dynamic?
I came in here for a get to see you day before I started, and I was introduced around everything, and I'm thinking there's too many names to remember. But then I went into some of the bits and pieces we have for the education side, and you see the sim wall, the ward, the bits and pieces do. John, who does all the electronics side of that, so passionate about trying to make sure he's helping everybody, and it was great to see. The investment that the trust has made into the Academy is fantastic. There's everything the student would need to make sure they're going to get the learning they want to get.
And in that really progressive, forward-thinking way. And I am going to be doing a podcast with John where we really deep dive into how we use sim and tel, because I think that is so
we had when I started, I had a discussion with John about other bits and pieces. He goes, "Yeah, we've already got that, Harry. And we've got it on VR." And I'm thinking, "Wow," you know what I mean? So it was really good to hear how forward-thinking the trust is.
Absolutely. So when we're thinking about the 4 pillars, where are they drawn from?
So they're drawn from the Health Education England's and NHS Improvement portion of the documentation.
Okay.
So in that document, it's a very long document, which I enjoyed reading. They found that the documentation tells you exactly where NHS England wants to get itself, you know what I mean? Yeah. And at Northumbria here, we're trying to make sure we're making sure we're above the benchmark, which every trust has to be. And it's really good to see as well.
Absolutely. Thank you for that, Harry.
No problem.
It's been lovely to talk to you. Can I just ask what your favourite thing to teach is?
Yes, so my favourite thing to teach is a skills session.
Okay.
I enjoy the interaction. I enjoy putting people at ease. I sometimes actually think I'm a hairdresser sometimes when I'm going around. I feel like saying when I'm listening to someone's chest, "Do you come here often? Have you been on holiday?" Stuff like that. And I enjoy that because when you're doing it in lecture theatres, the person just sits in and breathing deeply. But the reality of the job is that someone will constantly teach, someone will constantly talk, and in that situation, my experience, I'll be able to help you to make sure you can get past that to stop the person from talking as well. And I'm looking forward to instilling them little bits of knowledge into people as well.
So thinking about, it's like almost like simulating what is actually really happening rather than that like artificial environment where, like you say, the patient is really compliant and just does what you want and doesn't tell you about their kids while they're having their,
Exactly. I liken it to when you walk to talk to someone, you have to, coming to the leadership skills again, is you have to lead that assessment of the patients, and I'll be showing you how to get across that as well, so you can not be rude, but be attentive to how the patient's needs are.
Thank you.
No problem.